As we pay tribute to the lives taken on September 11th, we're reminded that many heroes emerged after the attacks too. Among them, medical workers at the World Trade Center Health Program at Rutgers, one of just 6 nationally that serve 9/11 first responders and survivors. Senior correspondent Joanna Gagis has the inspiring story of the doctor who leads the Rutgers team and one of the many survivors who say their lives have been touched.
When the North Tower collapsed, I happened to be by the Winter Garden Atrium, by the North Cove Marina. Fireman's radio was going off and it said, "Mayday, mayday, I'm trapped. Mayday, mayday, I'm trapped." I looked at the fireman. I was in a suit. He was in a full blown out Scott pack and had a Halligan tool. We penetrated the Winter Garden Atrium and found 2 EMS workers and a woman on a backboard that was, pretty banged up.
While most people were running away, Michael Vianney, a Secret Service agent at the time, ran toward the danger on September 11th, 2001. He and the firemen he assisted were able to save those trapped people just after both World Trade Center towers had fallen. It was during that rescue mission that he sustained severe injuries.
I guess you'd call it a rupture of my cervical spine. From there, I tore 2 torn rotator cuffs left and right.
As a federal worker, he received medical care immediately through the Department of Labor, but in 2008, he came across the World Trade Center Health Program at Rutgers University and says the care he's received since then has been life-changing.
Dr. Yudison and her team, they're heroes. I mean, they have not forgotten first responders.
The World Trade Center Health Program is one of 6 in the New York metropolitan area, serving those who responded that day and those affected in the weeks that followed. In total, there are some 400,000 people who were exposed to toxins at Ground Zero, according to the center.
We do the best that we can to keep our patients healthy, both physical health and mental health.
As the years have passed, the health needs have changed, says the program's director, Dr. Iris Yudison.
Initially, we saw acute problems, mainly upper and lower respiratory, things like asthma and sinus problems. Acutely, we saw post-traumatic stress disorder, more chronically developing into sleep apnea, gastroesophageal reflux, and now we're seeing a lot more cancer and more complicated mental health problems.
The program is funded federally through the Zadroga Act, and it allows them to monitor patients like Vianney over the course of their lives, looking for illness that may develop or scheduling additional surgeries, as was the case for Vianney just recently.
I'm grateful for the program. I'm grateful for, the fact that I think Congress has, supported this and will continue to support this because they're doing amazing work for people who, of course, there's initial injuries, but for some of these people that, are having long-lasting injuries that will go on for many years and sometimes just get forgotten about, but people like Dr. Yudison, they're not going to forget about it.
And while memorials are held around the state and nation, remembering the lives lost and the countless acts of bravery that day, today, Dr. Iris Yudison will be among those recognized. She's receiving the Service Above Self Award from the Federal Law Enforcement Officers Foundation.
I'm feeling really humbled because I do work really hard. I'm grateful that I have something that I can do. And in this crazy world, I am able to help people.
I'm so proud of her. I mean, like I said, she's probably one of the greatest people I know. And I know a lot of people. She puts everybody else in front of herself. She's a hero with a stethoscope.
A hero whose work will continue for years to come. For NJ Spotlight News, I'm Joanna Gagis.